Hi there, I'm Dr Phil. Today we're going to be talking about your bowels, what to do if you have problems with them. The message really is get help, but you need to know what your bowels are to start with, and they're part of your intestines, which are a very long tube which starts in your mouth and end at your anus. As a doctor friend of mine used to say, kissing is just sucking on a very long tube with poo at the end, which is a delightful thought, but curiously true. Your bowels are the lower part of the intestine, so the food comes in, you chew it, it goes down your gullet, in your esophagus, into your stomach, into the duodenum, and then into the small and large intestine, which comprise your bowel, into the rectum, and then out through the anus. And the curious thing about bowels is that people are often obsessed with them. They want to know how often they've been and what their poo looks like, but they're also often very shy at coming forward when they have problems. My consultant used to say the perfect poo goes twice around the bedpan and is pointed at both ends. Very few of us manage to do that. Often we suffer in silence. We either get pain, we get bloating, we have to force our poos out, or even worse, we get incontinence. You get a bit of leakage there and you can't make it to the toilet in time. It becomes socially embarrassing. There are certain social situations you avoid. Sometimes you avoid going out at all. Sometimes you have accidents when you can't make it to the toilet in time. Sometimes you become depressed. But the really interesting and important message about bowel problems is that they can nearly always be improved and often cured. And the problem is we're often too embarrassed to come forward. So although we think about our bowels a lot, it's quite embarrassing to go and see a doctor or a nurse or sometimes a continence specialist to talk about it. So how can you overcome that embarrassment? Well, the first thing is the confidence to know that there will almost certainly be something that we can do for you. And also, doctors and nurses and continence advisors are almost unembarrassable. You can take pretty much any problem to us. We'll have seen it before, and we want to help you. And it's often helpful to start with to write your problems down. What exactly is it that's having such an effect on your quality of life? Is it that you're getting lots of pain? You're really having to push your poos out? You're getting a bit of leakage? You're not being able to get to the toilet in time, you're having accidents, or the whole thing is making you depressed. It's quite useful sometimes to keep a diary of your symptoms, how often you're doing a poo, how easy it is to come out. A good poo should slip out fairly easily, and if you're having to push it out, or it's painful to push it out, or you're only doing poos occasionally that aren't really easy to come out, you're sort of pushing them out like rabbit pellets, then that's clearly a problem, but it's a problem we can often do something about. One of the other problems you get as you get a bit older is it's quite hard getting on and off the toilet, so often we raise the toilet seat or we put some bars there to help you get on and off, but that also raises your body position. And a good position for a poo is squatting down. So one of the things you can do is get a stool, I call it, a little stool you put your legs on that raises your knees up again, and that puts you in a better position to do a poo. So seek help, absolutely vital. Take in a symptom diary. Don't suffer in silence. There are all sorts of things we can do. Sometimes there are exercises to tighten up your pelvic floor. There are pads and things. There are ways of irrigating and cleaning so you don't get that itchiness or that messiness. And occasionally there are surgical options that can help you if you have these problems. But usually they can be sorted before that. And often there are lots of other things that cause it. So sometimes drugs, particularly drugs with opiates in, like cocodamol or codeine, can cause constipation. And a lot of people don't realise that. They take the codeine and the painkillers for something like back pain, but actually the pain of the constipation that the drugs cause is far, far worse. So often if you've got a constipation problem particularly, always think, could it be the drugs I'm taking? So when you go and see a doctor, make sure you take a full list of all the medications that you're on. Sometimes drugs can help, sometimes we give laxatives, but sometimes just drinking a lot of fluid and taking a good diet that has plenty of fibre in and fruit and vegetables can free those bowels up and get them back to normal. Please, if it's stuck down there and it's gone rock solid, it's not coming out, don't try and fish it out yourself. That often happens. People will pop a finger up and they'll try and do that. And that's something that really is best left to the experts. And there are lots of experts about who will do that. District nurses are particularly trained in that if laxatives and other measures don't work. People are becoming a bit more bowel aware about cancer. They know that if you get a sudden change in bowel habit that persists over a few weeks for no particular reason, if you get any bleeding at all, particularly if it's mixed in with the stool, and sometimes if the bleeding comes from higher up it'll be darker and sometimes smell absolutely foul by the time it pops out of the bottom end, those are reasons to come really quickly. And sadly, people don't always do that. The cure rates for bowel cancer are very good. There's lots that can be done for inflammatory bowel conditions, for irritable bowel syndrome, and as I say, for fecal impaction, when your bowels slow down, the poo logs up, it just won't come out. Plenty we can do for that, but we can't do it unless you seek help. So that's the big message here. Don't be embarrassed about your bowels, because your doctor, your nurse, your continence advisor certainly won't be embarrassed about it. Seek help early. Take in a list of your bowel symptoms, a diary of your poos, what other drugs you're taking, what you've tried to help already, and whether it's worked. And these websites will also give you really good advice and people you can phone to get advice and tips before you go and see a doctor. So don't delay, consult today. There really is no need to suffer in silence, and this could make a phenomenal effect to your standard of living. I know people who've had wonderful results from getting their bowels sorted, and it really has improved their quality of life. They've got out more, they've been able to get back to work, they've been able to enjoy social functions. And they always say to me, I wish I'd come earlier. I wish I hadn't just sat there and suffered in silence. So don't delay, get it sorted today. Oh yeah, and always remind doctors and nurses, particularly if they've been somewhere near your bowels, to wash their hands afterwards. Getting a bit of poo in your hands and then swallowing it just makes the bowel condition worse. So always, well, get one of these t-shirts if you want to, but don't be shy about asking doctors and nurses to wash their hands, because if you don't, it can make the bowel problems worse.